So let me just finish off the topic that I was talking about then.
Talk about your things and then I talk
Yeah,
about my things.
sure.
Let's chat.
Okay. So the 7 major factors that have recently improved cancer care are precision medicine, immunotherapy, liquid biopsies, targeted therapies that were mentioned just now, minimally invasive surgery, artificial intelligence, and generally the supportive care and survivorship care in cancer as well. So I've done my introduction and I've started off the topic. Robert, please go ahead, introduce yourself, and let's have a fireside chat about those 7 main topics then.
So I'm Professor Emeritus of Pathology, Environmental Health Sciences and Radiation Oncology at UCLA and at 4 huge public universities in China. And I have 16 patents. And it's my mission in life to make all creatures in the world healthy, beautiful, and sane. So 16 patents, and I can cure most, up till now, uncurable diseases. And I have something for almost all diseases. And I have also something for cancer. Can I talk a little bit about the cancer?
Go ahead, yeah, please do. Hold your microphone a little bit closer to your mouth.
Okay, so what my chemical is doing, I call it a chemical because all drugs have negative side effects, and we yet have to find any negative side effect of my drug. The worst thing that can happen to you is that you live longer without diseases, and without cancer and without diseases. And this is all patented. So for cancer, it prevents cancer, and I can deal with stage 1 and beginning of stage 2 cancer because it inhibits the proliferation of cancer. And it also supports the immune system, and it actually, in addition, gets rid of all the other problems with the immune system, which are allergies, but these are other things. So because it supports the immune system, at some point, the longer the cancer doesn't proliferate, at some point the immune system gets rid of it. And for stage 3 and 4, it gets rid of the side effects of chemotherapy and radiation therapy. And finally, when the cancer is excised, it's smaller than expected because it doesn't proliferate further. And after that, it actually inhibits a relapse. And it cures tons of other diseases too. So it's highly anti-inflammatory, and that's probably why it inhibits progression of cancer, because inflammation is involved in the progression of cancer and actually also the spread of cancer. So I have patients on lymphoma watch. They have not developed lymphoma so far. I have patients on prostata watch, which check their PSA level, and they have not developed prostate cancer so far. And none of my patients have developed cancer in the meantime.
This is fantastic. So how does it work? Is it like a targeted therapy like HR2 or BRAF? Or is it an immunotherapy? What kind of therapeutic would you say it is?
Yes. It's probably more likely an immune thing because it supports the immune system. It actually gets rid of allergies. It gets rid of autoimmune diseases and also infections. And we're doing lots of other things with it. So it's probably immuno, but it's also, I don't know. It's specifically an anti-cancer. So in mice. Lymphoma-prone mice, where 80% of them develop, this is an ATM model, where 80% of them develop, 80 to 90% actually develop lymphoma. They live 4-fold longer without, and the cancer onset is hugely delayed. Yeah, so these were the animal experiments, and in people it does the same thing. And it seems to work at least for lymphoma and prostate.
That's a very interesting point, because in my research that I've been doing, some of the more recent publications have found that in primary tumors in the CNS, glioma specifically, 50% of the mass is made up of immune cells, white blood cells.
Yeah.
And also with the new kind of ways of monitoring whether there is cancer growth post-therapy, it's more to do with monitoring specific types of white blood cells.
Yeah.
Would you have a comment
So
about that?
the
as
immune
well?
system
Yeah.
is highly involved in cancer initiation, in actually development of the cancer initiation, and the progression of cancer.
Mhm.
Yes, and that's probably where it modulates things.
Mm.
Yeah, but it also gets rid of precancerous lesions on the skin. I mean, this is my cosmetic cream that gets rid of precancerous lesions on the skin, which has the same chemical in it.
Okay. Are you allowed to talk about the chemical that you patented, or the process that you patented?
Sure, I can. It's all patented, so I can talk about it. The only thing, you guys cannot announce it to the public, because then it might have a problem with the FDA. Not that it's illegal, but I don't want. First of all, I don't want 200 million people to all of a sudden want it. And secondly, the FDA might have a problem with
Well,
with
just
publishing.
well, just to let you know, this is live on YouTube right now, so maybe let's keep it to ourselves, and if anybody wants to contact you,
Sure.
we can arrange that later then.
Well, it's live for our viewers.
It's a YouTube link.
It's yeah.
Yeah.
It's not to the general public.
I think it is. Anyone who has the link will be able to.
Who has the link? But these are all people who either registered for it or other affiliated people. It's not to the general public. I actually checked that before.
Oh, okay, fantastic.
Yeah,
Good.
yeah.
If you've checked, then
Yeah.
thank you.
Yeah.
Okay.
Yeah.
So how did you get into cancer therapeutics then?
Oh. Yeah. Well, I'm professor of cancer research. So I've been always, I actually did my PhD at the Department of Cancer Research at the University of Vienna, and both of my parents died from cancer. And so I have lots of, even personal, and I myself had cancer at some point. So
Sorry to hear that.
I had a lot of, but it's all completely gone now. So I have personal experience, and I have lots of experience from my patients. What I do is actually I listen to my patients, and that's very important. And about everything, even things which are unexpected or novel. And then I test that with a new patient population. And if it's something completely novel, then I have a new patent. Yeah. It also has psychological effects. So I'm also curing most psychological and psychiatric problems. So it cures both the body and the mind at the same time. And that's also one thing about cancer somehow, that it also has psychological effects. And cancer patients have psychological effects. Yeah.
And tell me a little bit more about your trials, or the way that you've developed your research, then, just so that the public will know, the public here. And then I think maybe we'll move on to some questions. Does that sound like a good idea?
Sure.
Yeah?
And maybe we can collaborate with you seem to have patients, and see, brain cancer is also something which would be interesting, and actually maybe also some psychological effect, or maybe the brain cancer affects some psychological factors and psychiatric things as well.
Yeah, absolutely.
Yeah.
Okay.
So what was the question again?
So the question was, tell me a little bit more about your trials, your research, how you actually arranged the trials with patients, maybe
Oh,
something along those lines.
I have about 50 clinical trials internationally going on with my thing. How it's arranged, well, I have patients and I talk to the patients,
Mhm.
which not every doctor does actually.
Yeah.
And I have a very detailed talk with my patients. And I listen to all the things they tell me, not just about the particular endpoint and the particular disease.
Mhm.
And I think that is the difference, that I find new things by talking to my patients. And every patient has 4 to 5 things my chemical fixed.
Mhm.
Normal people.
Okay. And how long, what length of period do your trials undergo? Is it like a 6-month with a follow-up, or?
So actually, so let me introduce the whole thing. I got a CMCR, a Center for Chemical Countermeasures Against Radiation Risk,
Mhm.
15 years ago, and I got $31 million from the NIH, and it took me 10 years for all the preclinical work and everything to develop that.
Mhm.
And then it took me another 2 years unsuccessfully trying to convince the pharmaceutical companies to do clinical trials with it.
Mhm.
And about a little less than a year ago, I decided, after unsuccessfully negotiating with Roche for 6 months, because everybody was interested and everybody was interested, but nobody signed anything. So then I decided with my clinical director to design our own clinical trials and start our own clinical trials. So, and that was the best decision in my life.
Absolutely.
You cannot rely on anybody else, even with the best preliminary data, to do something for you. You have to do it yourself.
Absolutely.
And now all the pharmaceutical companies are interested in it.
Mhm. That's
Yeah.
fantastic news. Congratulations.
Yeah,
And not just for yourself, but potentially for patients worldwide.
sure, sure,
Yeah.
sure.
So I would like to.
So the CMCR is a Center for Chemical. So the charge was actually to find something that, in case of a nuclear bomb or a dirty bomb or a radiation accident like Fukushima, or that to have something for the first responders that they survive better. So what the chemical does, after an LD100, where 100% of the mice die, you give the first dose 24 hours later, so after the radiation, okay? All the mice which would have died are now alive. So it completely reverts the radiation damage, and these mice are now living a normal lifespan. So there's also no late effects of radiation. And it works in yeast, in human cells, in zebrafish, in mice, and it cures tons of diseases in those animals, and human keratinocytes live 15% longer with it, and mice live 33% longer with it. So that's 20 years in human life expectancy. So the worst things that can happen is that you live longer without diseases. And now since half a year, we're doing clinical trials with it. And it already cures almost all the until now uncurable diseases, and that includes COVID and diabetes, and I mean, I could talk for 10 hours about it. Yes, and it has a very fast action. So what it does, it induces in our body 244 different proteins. There are lots of anti-inflammatory proteins and DNA repair proteins, and also 9 neuroprotective proteins. So it's actually the first time that you have something that protects our brain cells, our neurons. And thereby it has also psychological and psychiatric effects. And it's highly anti-inflammatory, so it has also immune modulating effects. And also, I mean, it gets rid of allergies. It cures gluten allergy and coffee allergy and garlic allergy. And it gets rid of infections. It gets rid of COVID. It gets rid of tapeworms in my cats. and we are doing tons of additional things with it. We're even doing, we're even trying to get rid of antibiotic use in agriculture because it supports your immune system and to increase the meat quality with 10,000 cattle. Because it also gets rid of sore muscles and of inflammation, so it should increase the meat quality. We are doing tons of other things with it too.
That's fantastic. So I've got a couple of questions before we open up the floor. How do you get the dosage right, or is there a dosage, or can you just keep on taking whatever dose, kind of like psilocybin? You can't really overdose on it, and
Yes.
you know there's kind of mental health benefits.
Yes.
To
So
it.
that's an excellent question. Actually, we have not defined the optimal dose yet. But what we're using is the effective dose in mice we're using now in people, and it doesn't matter so much because 100-fold that dose is completely fine with mice over 4 generations. They do everything a mouse does, same litter size, same everything for 4 generations, 100-fold that dose. It's so high that it even falls out in their tissues. And it has no negative effect whatsoever. So it doesn't matter so much. But it's a very good question. One should actually use a minimum effective dose. So maybe one has to fiddle around. And for different diseases, actually, it might be a different minimum effective dose.
Yeah.
So that's a very good question.
Yeah. And you've kind of answered the question that I was going to ask, my second question. Are there any kind of autoimmune responses? But you've answered it. You said that there are no...
Well, because it supports the immune system, it also gets rid of autoimmune.
Yeah.
Yeah.
Okay.
Yeah. So it has no negative. It also thins your blood, so it gets rid of blood clots. And that's the only thing that, I mean, if you are hemophiliac, but we haven't tried. None of our patients have been hemophiliacs yet. That's the only thing that. But I don't think it would actually be a problem. It's just an overcautiousness that we exclude hemophiliacs. But the reason why I don't think it's a problem because it does not interfere with the blood clotting by itself. So it doesn't interfere with any factor. It's anti-inflammatory and actually inflammatory factors make your platelets sticky, and that's why you get blood clots. So it gets rid of those inflammation. It's still, so the blood is still sticky once it's exposed to air and whatever. So I don't think it would do that. But the only thing that it causes, if you have a flu, you might have more frequent nose bleedings. But nobody ever died from nose bleeding. And if you find that, then you just reduce the dose a little bit, and after 12 hours, this propensity for nose bleeding goes away. And it's not very bad either. So that's the only thing which we found. And the other thing that it makes your hair grow, and some people, and it increases vision, so I can get rid of all eyeglasses or laser surgery. I had myself had eyeglasses, and 4 weeks afterwards it cured 2 diopters and 1 astigmatism. So it does tons of other things. And you just have to clip your hair. That's the only thing, even your body hair. And on top here, this is all new hair. I was bald for 30 years, and Now hair is growing out of the top of my head. Yes.
Yeah, we've got the same problem. Any questions? Can I open the floor to questions? Please go ahead, use the microphone.
Very interesting talk. I spoke yesterday. I think that I launched Gleevec in chronic myeloid leukemia, which was a great drug. Interferon was probably standard of care in bone marrow transplant as well before
Yes.
that. But it developed mutations. And that's why you know, that's pretty scary. We thought we had the magic bullet, but like 5 years later, we started to see mutations from the drug. So what is your view on that, and can you ever really stop that?
Well, see, so this was the original experiment. It actually reduces mutations. It's an anti-mutagen. And actually it reduces even radiation-induced mutations. That was the original selection. We screened through 16,000 chemicals for something that reduces radiation-induced DNA deletions and radiation-induced toxicity. So it would reduce the mutation frequency.
Got it. And there's one more question. I also, for Celgene, we launched RadMit for multiple myeloma. I talked about this yesterday. You know, originally that was thalidomide, right? The drug used in for morning sickness in women in the 50s and 60s. The reformulation, I mean, this is the amazing thing. The scientists that thought about that, how do you think that came about? Because I kind of know this story, but what is your view on that?
The reformulation of...
Well, it was
thalidomide?
Thalidomide to lenalidomide. That's lenalidomide's RadMit, and that's used in a multiple myeloma. So
yes,
that's you know. So here we had a teratogen, and like
yes,
years later, now it's a cure
yes.
for, not cure, but one of the best drugs for multiple myeloma.
Sure. So some chemicals, yes, have all kinds of other effects. Yeah. Sure. But at least mine, they don't cause burst effects. At least not in mice, and in people we don't know, but it should not. I mean, yeah.
Please, yes.
This is kind of a personal question. My mother-in-law was recently diagnosed with stage 4 rectal cancer, and it spread to her lungs, liver, lymph nodes, kind of everywhere.
Mm-hmm.
She did several rounds of chemo, lost the sense of taste and every texture, everything was, and she started declining, not able to move much, so they canceled her treatment. Her son is, my husband is researching on the Finbin, I don't know, the Joe Tippin's protocol, and Finbinazine, it's a dewormer, I don't know, and I think he's trying to find answers in holistic approaches or other medications that she might be able to, that might be a miracle. What are your thoughts on that? And I know that's probably a loaded question, but it's just something very personal.
No. I have lots of chemotherapy patients. So my first chemotherapy patient, he threw up 4 to 5 times a day, lost weight, and just wanted to die. 1 week later, he drove his motorcycle for 320 kilometers. He stopped throwing up, gained weight, started eating with appetite, and he started doing things. He didn't want to be in bed anymore. Once the surgery came, the cancer was smaller than expected, and the second chemo was no problem whatsoever. So it gets rid of the side effect of chemo, and it also reduces the further the further progression of cancer. My second chemotherapy patient was a woman with breast cancer, and she started wheezing and coughing, and her daughter thought actually she's going to die. And her daughter is on my chemical because of a pancreatic cyst, which she wants to prevent from developing into cancer. And Steve Jobs died from pancreatic cancer. So she gave some of the chemical to her mother, and after 1 hour, her mother was sound asleep rather than dying. So it gets rid of the side effects of chemotherapy, and it also reduces the further progression of the cancer.
Thank you.
And finally, it actually inhibits the relapse of cancer because it's an anti-cancer agent.
Thank you for
And
your
anybody
question.
who wants information about it, I'm happy to send you information. I just need your business card, and I give you my business cards, and I send you information.
Thank you for that personal question there. And I'm sure you'll be meeting up later.
Yeah.
Any other questions? No. Would you like to add a final note or a message of hope, given your experience and your research? Any final words before we move on to the next session?
Sure, that what I really want to do in life to treat as many diseases as possible, and to make everybody happy, because I'm also curing psychological and psychiatric diseases with it, and so there's lots of comorbidities. Lots of patients actually also have psychiatric problems because of the disease. And one good example of that was one of my diabetes and long COVID patients. This is how I listen to patients. He actually was in pretty bad shape. He was mostly in bed for 4 years, and he told me he has this ugly old wife. And a week later, he calls me back and was bouncing off the walls. He couldn't stay in bed anymore. He was hiking for the first time in 4 years. And he always wanted to be outside now. And he told me he has this beautiful, loving wife. Okay? So it's not just cured his disease, but also it saved their marriage.
That's a wonderful note.
So that was the first indication, actually, that it might have some psychological effects as well. And then I started testing that on depression and other psychological diseases, and that was my 16th patent. So I'm listening to my patients exactly what they tell me, even strange things that, and then if that's fixed, then you have a new hypothesis and theory to test something new, and then you get a new patent and a new disease being fixed.
Fantastic. People always say that love saves all, but maybe in your case, health saves love.
Yes, yes. So I want everybody to be happy, beautiful, and sane, and healthy.
That's beautiful. Thank you very much.
Yes.
Thank you, Professor. And thank you, everyone, for joining us today.